Dr. P.V. Prasad. Is Dr. Namita Dave over here? Yeah, please be ready.
Good morning, everyone. I am Dr. P.V. Prasad, postgraduate from Narayan Netra Uveitis. We have no financial disclosures in this study. More than 2 centuries ago, we witnessed color fundus photography, which helped in the diagnosis of many retinal pathologies. However, it has following limitations like poor images due to media opacities, limited resolution contrast images, interpatient variability of fundus pigmentation and illumination. So we need something for better contrast fundus images, images capturing through undilated pupil, and better visualization of pathologies at various levels of the retina. So all this can be done by multicolor imaging designed in Spectralis SDOCT from Heidelberg. It uses confocal scanning laser ophthalmoscopy. It captures 3 simultaneous reflectance images using 3 monochromatic laser sources, like blue reflectance of wavelength 488 nanometers and green reflectance of wavelength 550 nanometers and infrared of wavelength 820 nanometers, all which can penetrate the retinal surfaces at different depths. So multicolor imaging is a combination of blue reflectance, which can penetrate up to inner layers of the retina, and green reflectance, which can penetrate intraretinal layers, and infrared, which can penetrate outer retinal layers till RPE and choroid. This is the final output of multicolor imaging showing all reflectance images. So literature is saying that multicolor imaging helps to define and better localization of various pathologies within the retina. And there is improved definition of drusen, pseudo-drusen, pigment clumping and exudations. So the aim of our study is to assess clinical application of multicolor imaging in posterior uveitis. Coming materials and methods, our study is observational cross-sectional study approved by our institutional ethics committee, and we included the patients diagnosed with posterior uveitis in outpatient department of uveitis and ocular immunology services. Written informed consent has been obtained from all the subjects before fundus imaging. So 50 patients were included in our study in age group of 5 to 75 years who underwent comprehensive ophthalmic examination, including the visual acuity, detailed anterior segment examination by slit lamp, and fundus examination including the scleral indentation, and color fundus photography using the Topcon fundus camera, and multicolor imaging using the Spectralis. So all these images captured were analyzed by 2 independent observers separately, and differences in the appearance of various pathologies seen in the different cases were analyzed and tabulated. So various pathologies we studied were epiretinal membrane, ILM folds, retinitis, and neovascularization, exudates, RPE alterations, choroidal lesions, pigment epithelial detachments, and optic disc edema. So each pathology was graded from 0 to 2 for each of the 4 images. 0 means it is absent in the particular reflectance image, and 2 is it's clearly visible in the particular reflectance image. Total score was compared for each of these pathologies. Sensitivity, specificity, and inter-rater agreement between the 2 methods was analyzed. Kappa statistics was calculated to evaluate the agreement between the 2 observers. Results. This is the case of serpiginous-like choroiditis along the inferior vascular arcades extending superiorly, seen in the color fundus photography. On subsequent multicolor image, serpiginous-like choroiditis lesions are better visualized in the multicolor image when compared to the color fundus photography, showing the multifocal choroiditis lesions surrounding the optic disc on color fundus photography. On subsequent multicolor imaging, ILM folds also visible in the multicolor image surrounding the lesions. These are various reflectance images in the multicolor. And the multifocal choroiditis lesions are better visualized in the multicolor imaging when compared to the color fundus photography. The ILM folds visible only in the multicolor imaging but not in the color fundus photo. We studied the cases of both autoimmune and infectious etiology. This is a graphical representation of visibility of various pathologies seen in the color fundus photo and multicolor images. Pathologies like ILM folds, epiretinal membrane, and retinitis were better visualized in the blue reflectance images, and hemorrhages, exudations, and retinal vascular pathologies are better visualized in the green reflectance images. RPE changes and choroidal folds are best appreciated in the infrared reflectance images. Coming to the discussion, superficial pathologies were best appreciated on blue reflectance images, and on green reflectance, NVEs, exudates, and hemorrhages were best appreciated. In the infrared reflectance, deeper pathologies like RPE changes and choroidal lesions were best appreciated. Improved definition of optic disc, retinal, larger choroidal vessels appreciated on the multicolor imaging when compared to color fundus photography. Inter-rater agreement, kappa, which was calculated, was very strong in our study. Multicolor imaging gives higher resolution and good contrast images due to reduced light scatter. And images can be captured through the undilated pupil. However, it has following limitations: a slightly longer period of fixation when compared to the color fundus photography. It's more prone for artifacts due to corneal opacities, significant cataracts, and improper alignment of the lens. And this is a multicolor image showing the brighter spot at the macula. This is due to the artifact because of dense cataract. And this is a multicolor image showing the artifacts due to improper alignment of the lens. We appreciated the significant artifacts in 5% images in our study. I would like to conclude that multicolor imaging is a novel diagnostic tool, an improved definition of retinal and larger choroidal vessels appreciated in multicolor imaging. ILM folds and fibrovascular membranes visualized only in the MCI but not in the color fundus photography. However, further studies need to validate various details seen in the multicolor imaging with other imaging modalities. To the best of our knowledge, this is the first study reported on multicolor imaging in posterior uveitis. Thank you for your attention.
Do you think the people will get people?
Sir, what we observed in our case studies with undilated pupil also, there is a better picture clarity when photos.
Not better.
Sorry, sir?
The undilated people and the dilated people, there is no difference in the imaging cases.
There is slight limitation with dilated, undilated, but there is a quality of the image, sir.
With dilated
Color fundus
people.
photos.
With the dilated people.
Yes, sir.
Any questions from the floor, please?